Okay, so I chose to conduct a training regarding specifically youth alcohol use because we often lose sight of what we're trying to accomplish in prevention. We get caught up in data and numbers, and we try to address multiple substances in our community at once. So we may say in our community, yeah, I know there's a meth problem or a heroin problem, but we lose sight that usually youth start out with alcohol. They don't usually go straight to those hard drugs. It's usually they start with alcohol. So that's why just for this webinar, we're going to focus specifically on the prevention of alcohol use. So before we get started, I'm going to tell you a little bit about me. My name is Jaden Patterman. I'm a prevention specialist for Preferred Family Healthcare in Kirksville, Missouri. There's my direct email address and my direct phone line. I do work in Service Area 13, and so the counties that I cover are listed there. We also have two other prevention specialists that cover, our whole department covers the northern 27 counties altogether. And our main duties are to mentor community substance use prevention coalitions in the strategic prevention framework. So these are the topics that we're going to be covering today. We're going to look at statistics related to youth alcohol use, specifically here in Missouri. We're going to review some of the consequences that are associated with youth alcohol use. We're going to look at gender differences and specifically why both males and females are motivated to use alcohol. And it's not going to be the same for all males and females, and I'll say that again later. It's just the patterns and trends that we're seeing in research. And then lastly, we're going to go over prevention strategies that you could possibly implement in your own community to address the youth alcohol use problem. So let's get started with the statistics with youth alcohol use. So this information is pulled from the Missouri Student Survey, and it's given every 2 years to schools that wish to participate. So if you're wondering if your school district does participate and you find out that they don't, encourage them to do so that you have this information, because it's really helpful and it's really interesting to look at. And the results are available online for the Missouri Student Survey, and it can be broken down by county. If you just go to Google and type in Missouri Student Survey, you should be able to find it. But if you do have trouble locating your county, just reach out to me and I can help you find that information. And then if you want to look at a specific school district in your area, if your school did participate, then the superintendent should have those results for you. All you have to do is ask them. So as you can see on this chart, alcohol is highest in lifetime use for both Missouri and the United States, with Missouri's being noticeably higher than the state average. Ours is the 34.5% lifetime use, if a youth has ever used alcohol. And then in the United States, the lifetime use is 27%. So ours is a little higher than that. Missouri is also higher than the U.S. average when it comes to past 30-day use. Ours is 14.5% compared to their 9.2%. And you will see that in past 30-day use, electronic cigarettes are a little bit higher than alcohol. And those are on the rise, but that's a whole nother topic altogether. And then there was not past 30-day use for electronic cigarettes for the United States, so we can't compare those results. But the point of this is, when you break it down by county, this is typically what you see, that alcohol is the most commonly used substance among youth. So moving on, this is a graph pulled from a national survey, so it's not necessarily specific to Missouri, but the trends are still the same that we see. So as you can see on this, alcohol use, binge alcohol use, and marijuana use all start climbing in early adolescence, and it keeps going until it peaks in about that early to mid-20s stage. And as you can see, among all drinkers, first alcohol use was about 17, and those that are underage, it was between about 14 and 15. So that's why we are addressing the age group that we are, around 14, 15. So next, this graph shows the trends in youth alcohol use compared to adults. As you can see, adolescents tend to drink less often, meaning fewer days per month, but they're drinking more during those occasions compared to adults. So it kind of shows you the general pattern. Like it says, underage drinkers consume an average of over 4 drinks per occasion, 5 times per month. And if you think about it, that's actually quite a bit. So youth do drink less number of days, but they are drinking more than adults. Okay, so next we're going to look at some of the consequences associated with youth alcohol use. And the reason I kind of wanted to go over some of these is because sometimes we forget all the areas of a youth's life and those around them that are affected when they drink alcohol. So that is why we were going to go over these. So first, of course, developing an addiction is one of the most dangerous consequences of youth alcohol use. Those that begin drinking at the age of 14 or younger are at a significantly higher chance of later on in life abusing alcohol or becoming completely alcohol dependent. They're actually more than 7 times when compared to those who don't start drinking until the legal age, 21 or older. So essentially what this is telling us is that the longer a youth waits to drink, or a young adult, then the less likely they are to abuse alcohol or develop an addiction later on in life. So again, that's why it's important that we are targeting that younger age group, because we would like them to at least postpone their alcohol consumption until later in life. So as we know, alcohol affects not only those that choose to drink, but others in their community. We just covered that earlier use leads to addiction. A few of the other consequences that we might not always think of. One, the most serious, of course, being the risk of death. It's the third leading cause of preventable deaths. So whether that's, alcohol poisoning, traffic crashes, any other accidents that might be associated with youth, it is the third cause of preventable deaths. So that's really important. It also leads to engagement in risky behaviors. So there might be more injuries associated to it. They're very impulsive after they've been drinking. There are more suicide attempts that happen after a youth has been drinking. They're also more likely to get into a vehicle with someone who's been drinking if they have been consuming alcohol themselves. They're more likely to engage in criminal behavior after drinking. And then, of course, alcohol lowers their inhibition, so they might have that poor decision making, which could lead to unprotected sex, unplanned pregnancies, STDs, that sort of thing. Alcohol is a depressant, and it could intensify or worsen any mental health symptoms a youth is experiencing. There could be a decline in school performance, whether they're skipping school, just not doing their homework, that sort of thing. And as we know, youth brains are still developing, so there could be those cognitive deficits that occur because of the youth alcohol use. And then they're more likely to use other substances, as listed here, tobacco and other substances too. Okay, so there is good news though. Those of you that are working in your communities to try and combat youth substance use, it is working. So alcohol use is decreasing over time, and this graph shows 8th, 10th, and 12th graders. And as you can see, the decline is pretty significant. So in 1975, it looks like it was about 38% in 12th graders, and then now it's 17%. So that is a pretty significant decline over time, but there's always a but. There has been an increase in number of emergency department visits despite the decrease in overall drinking. And that increase is actually pretty significant as well. 33% increase in alcohol-related emergency department visits for people aged 18 to 24 in the past 8 years, well, since 2014. So as this suggests, there could be that increase in intensity of binge drinking. So there may be, what this is saying is there may be less youth that are drinking, but those that are consuming more alcohol than they used to, because that's what this is suggesting with the 33% increase in emergency department visits. So that's what we can take away from that. Okay, so now comes the really interesting stuff, differences between genders when it comes to why they consume alcohol. And before we get started on that, It's important to be aware of how our brains work and the reward system and how that relates to alcohol use. So you've probably heard at least once before positive and negative reinforcement, but I'm going to go over these. Positive reinforcement is when we keep doing a behavior because it adds something positive to our life. Negative reinforcement is when we keep doing a behavior because it takes something away from our life that is negative. So positive, we're adding something. We keep doing a behavior because it's adding something positive. Negative, we keep doing a behavior because it's taking away something that's negative. So we're going to keep those in mind as we move forward. And as this relates to alcohol, one might continue drinking alcohol. Positive reinforcement would be because it keeps adding that pleasure. They're getting that euphoria out of it. Negative reinforcement, one might keep drinking alcohol because it's taking away something negative, a negative feeling such as stress, anxiety, or depression. So keep those in mind. But first I want to show you that it used to be that males drank quite a bit more than females, but now that gap, the gender gap, is closing and they drink about the same. So as you can see from both of these graphs, there is still that very large decline, but on the right side of the graphs, they're getting really close together, meaning that males and females are drinking just about the same. So the left is the percentage of binge drinking, those who had 5+ drinks in a single night during the last 2 weeks, and this is all seniors in high school. And the right graph looks at those who drank every day during the last month, which of course that's significantly less than the binge drinking, but still the males and females are getting very close together on that. And another interesting fact is that females have been more likely to report blacking out, meaning they're consuming alcohol to the point that there's memory loss. So although males and females do have that different number of drinks that it takes to get to that legal limit, that suggests females may be drinking a higher number of drinks over that threshold than males are. Okay, and again, I want to point out that the next couple slides contain information that might not be true for all youth, but this is just what studies have been revealing about the trends or the patterns associated with alcohol use by young males and females. So let's talk about sensation seeking and impulse control, and trust me, this will all make sense as we keep going. That's my hope. So sensation seeking is looking for the thrill or the pleasure or excitement out of something, just like it sounds. And impulse control is being able to make appropriate decisions and control those urges. So what the left graph shows us is that sensation seeking, looking for that thrill out of things, increases for both males and females during adolescence, but it's higher for males than it is for females. And on the opposite side of that, impulse control, being able to control those urges and make those appropriate decisions related to the sensation seeking, that decreases for both males and females, but it's lower for males than it is for females. So because sensation seeking is higher and impulse control is lower for males in adolescence, that's why they're typically driven by positive reinforcement when it comes to drinking. They're looking for that pleasure or the excitement and thrill out of drinking, and they have the low impulse control. So it used to be believed that addiction was all based on positive reinforcement. We thought people only drank to get the thrill out of it, but research has shown us otherwise. Research has consistently shown us that females might consume alcohol for different reasons than males. So it appears that the motivation for female youth alcohol use is that negative reinforcement, and specifically to take away those negative feelings, that stress, anxiety, depression. That suggests that stressful experiences and mental health concerns may be the drive behind youth female alcohol consumption compared to males. And the likelihood for addiction is actually higher when the motivation is based on negative reinforcement. So when one is drinking to take away those negative feelings, that's when addiction usually occurs, which is opposite of what we used to think. So it's possible we could see a rise in young females struggling with addictions because they are driven by that negative reinforcement. So in review, long story short, males tend to consume alcohol to add pleasure to their lives, and young females tend to consume alcohol to take away that stress and anxiety. Lastly, let's take a look at some of the prevention strategies that can be implemented in our communities to address youth alcohol use. Firstly, it's important to note that prevention is a collaborative effort. All the work doesn't fall on one person's shoulders. So in our department, we work with community substance use prevention coalitions, and those are formed with volunteers from each of the categories listed here, usually involved in one way or the other, whether that's coming to meetings, financially contributing anything they have to offer. Usually somebody from each of these sectors is involved in that. And the main goals of the coalitions we work with are to reduce the amount of youth substance use in their communities and to provide safe alternative activities for the youth to participate in. So if you're interested in joining or even starting a substance use prevention coalition in your area and you'd like any additional information on this, please feel free to contact me. And like I said, even if you're not in that 9-county area that I cover, we do cover all 27 northern counties in Missouri. And then my contact information is at the end of this as well, so don't fret if you missed that. So moving on, one size does not fit all when it comes to prevention strategies, and we know that just by looking at the gender differences that we just saw. So at an individual level, just being aware of any differences like these gender differences, it allows for targeted prevention efforts, and that could mean education relating to what other alternative activities there are to engage them in that sensation seeking that don't involve alcohol. Or it could be education on how to utilize effective coping mechanisms when they come upon a stressful life event rather than turning to alcohol. Other risk factors that you might be able to target are having a family member or friend who consumes alcohol, having a low perception of the harm that's associated with drinking alcohol, or having easy access to alcohol, whether they're getting it easily from the store or they're getting it easily from a family member or friend. Moving on, having an evidence-based substance use prevention curriculum in schools can be a great way to expose all students to prevention information as they are in school at that time. Family-based interventions have the potential to improve child-parent relationships. It can help strengthen those family communication skills, and it can help increase the child's coping skills. All of those are protective factors, which are opposite of the risk factors we talked about. Risk factors increase the likelihood that the youth will engage in alcohol use, whereas the protective factors decrease the likelihood that they'll engage in that alcohol use. There are also things that can be done in the community. So compliance checks, those are run by law enforcement, but it consists of sending a youth into an establishment that serves alcohol and having them try to purchase that alcohol. And then if the establishment is doing what they're supposed to do, they'll of course deny this because the youth is underage. But if they do go ahead and serve the alcohol, then there are legal ramifications in place. Keg registration, that involves if an individual does purchase a keg, their name is attached to that, and then if a youth is found, underage drinking at that party or wherever the keg is, then the person that supplied it is also legally responsible. Environmental changes, I'm actually going to be doing a webinar in February on this, so be on the lookout for that as well. A simple environmental change example would be if you know that youth in your community are drinking at a certain park because there's low lighting, just adding street lights there would be a simple environmental change that could possibly decrease this youth. And then policy changes with tobacco. A lot of people are doing the Tobacco 21 where they're raising the legal age from 18 to 21. For alcohol, it could be working with local bars or clubs not to let 18-year-olds, just strictly 21 plus. And then lastly, social host liability. This would be having somebody held liable if they are found, serving to underage people. And this is super important because, and this is from the Missouri Student Survey again, so this is all of Missouri. Most youth in Missouri report that a friend or family member gave or sold them alcohol. So that's where they are getting the alcohol from, is from friends or family members. And stats also show that this is where alcohol is most commonly consumed, either at their own house or a friend or family member's. They're not doing it at bars, restaurants, clubs. Usually it's rather at a friend or family member's house. It's also true that some of the best prevention happens around the dinner table. Adults play a huge role in preventing or delaying drinking and helping young people make the right choices about alcohol. It's probably not surprising, but research has shown that among kids 12 to 17, those kids that believed their parents would strongly disapprove of them using a drug did so less than those whose parents just somewhat disapproved or approved fully. So this Talk About It Missouri, this is an example of a statewide media campaign, and this is what Missouri is currently doing. This campaign encourages parents to talk with their children about substance use, and it provides talking kits to use with children all the way from pre-K to 12th grade. And you might think pre-K is pretty young to talk to them about the drug use, but those aren't necessarily surrounded about the topic of drug use, but more so making positive decisions and that sort of thing. And much of the information for this campaign is disseminated through social media, but these are examples of flyers and cards that have been given out to parents of children in Missouri. And then radio ads, billboards, and television ads are also used. So I am going to try to show you a quick commercial here. I apologize if it's laggy on your end at all. I tried this yesterday and it worked out perfectly, and then today it was kind of a disaster. So I'm going to start it on my end, and hopefully you can view it. If you can't, let me know and I can send you the link to this, and that would be no problem as well. So this just gives you a little bit of an idea of what Missouri is doing to target the parents of youth, because we know obviously from what we've looked at how important this is. So I'm going to start it now and we'll see if it works on your end.
What's more important to you than your child? Protecting your family against drug and alcohol. Misuse starts with early conversation.
Okay, so hopefully you were able to view it. Like I said, if you weren't and you would like to, just put your email address in the chat box and I can email that to you, no problem. So that's just an idea of what Missouri is doing. That would be a social media campaign. So lastly, I just wanted to show you an example of an ineffective prevention strategy. Some people think, why don't we just use the European model? And if you're not familiar with that, that's where parents provide their children with alcohol at their home at a younger age than is the legal limit. And their hopes by doing that is to kind of build their tolerance and reduce binge drinking outside of the home. And the answer to why we don't do that is simple. It's because it does not work. So as you can see by this graph, USA is in the red there. And the U.S. teens are far less likely to binge drink alcohol in a year when compared to teens across Europe. So the European model does not work. Okay, here's a list of resources where I pulled the data from for this webinar. If you'd like access to any of those, just let me know and I can work on that. So I know I went over this rather quickly, but like I said at the beginning, I am recording this and I'll be sure to post the link on our Facebook page so you can review any information that you might have missed or just want to go over. And also feel free to share this presentation with anyone else you think it might help. And again, here's my contact information. If you send an email to that moprevention@pfh.org, that actually goes to all of our prevention team. So someone will be able to get back with you fairly shortly. And then if you're not already following us on Facebook, please do so to get valuable substance use prevention and mental health information. And then before you do go, if you would be kind and take that evaluation survey, that would be wonderful. It should be on the right of the screen and under web links 3, and it says evaluation survey. If you click on that and click browse to, it should take you right to the evaluation. If you have trouble accessing that, also just put your email address in there and let me know, and I can send that to you via email. Thank you in advance for taking that. We're always looking for ways to improve our trainings. Thank you for taking an interest in this topic, as it's very important, and I hope you enjoyed the content and found it interesting. So please take the survey and have a wonderful rest of your day. And just let me know if you have any questions. I'll hang around here for a couple more minutes, and you can just put any questions in the chat box. Thank you.